Ideally, they are the fibroid uterus, which is causing problem for them. So many times the girls comes with the growing up stomach area where the fibroid is growing and they're having some mass over the uterus. Sometimes girls are coming with the constipation. They are not able to pass a stool normally, and they are having constipation. We give the medicine for the constipation. May I request somebody who is open? They can put themselves on the mute. And sometimes they are having burning and throbbing pain during the sex. Sometimes in the IVF clinic, the women are going with the fibroid because fibroid can cause
Ma'am, can you please allow some time for Jonathan to translate?
Right.
Jonathan, please, are you on call? Jonathan?
Yes, I'm on a call. She gave a lot of
Yes.
information, kind of lost. So
Okay,
if
so I
she
think
can
you
go
can start
back
from
to
now.
that.
Yeah.
We can start from beginning.
Just you can go step by step so that I can give you all the information, or else I'll summarize and that will not be good for the doctors, like French doctors.
Right.
A lot of information is kind of hard. Thank you.
No problem. We'll just go with the first slide. Fibroid is not cancer. They are rounded growth over or inside the uterus, and it is the most common problem in the young female. May I go to the next slide?
OK. Le fibroïde est une progression non cancéreuse de...
Okay.
affectant l'utérus.
I'll read one slide and then you can translate in the French, and then I'll proceed for the slide. Okay?
No worries. That's okay.
Yeah.
That's okay.
Okay. The risk factors are like high hormones in the body, and age is 30 to 40 years. If the girl is having obesity, high blood pressure, or family history of fibroid, they are at risk of developing fibroid.
Jonathan, please translate.
Comme on le disait, le fibroïde est une croissance non cancéreuse de muscles au niveau de l'utérus, et les facteurs sont les suivants. C'est la densité hormonale telle que les estrogènes et l'âge entre 30 à 40 ans. Yes, please.
Thank you. Mostly the complaints are anemia, means they are having the blood loss and therefore they become anemic. Yeah, you can carry on.
Souvent les gens ayant cette maladie sont des problèmes liés au sang. Bon, ils ont un peu la baisse quand il s'agit de la pression du sang. Yes, please. Bonjour.
Sometimes they are having pain or urine problem or stool problem.
Et souvent, par moment, ils ont de douleurs ou encore de problèmes urinaires. Yes, please.
Sometimes fibroid can cause infertility. They block the tube and they make the distortion of uterine cavity. So embryo is not adhered there.
Par moment, le fibroïde peut causer l'infertilité et ça peut bloquer la voie de la reproduction. Yes, please.
If the female goes in pregnancy and they are having fibroid, It can cause miscarriage or abortion. They can cause premature labor pain, heavy bleeding after delivery.
Euh, les dames qui sont atteintes de cette maladie peuvent faire de mauvaises couches, de fausses couches plutôt, ou encore cela peut conduire à l'avortement. Yes, please.
How we can see the fibroid? We can see on the ultrasound, and exact location we can see on the MRI.
Comment est-ce que nous pouvons localiser? Can you hear me?
Yeah.
You still hear me?
Ultrasound and MRI, there are two modalities where we can diagnose the fibroid: size, location, number.
Ok. Les deux moyens pour pouvoir diagnostiquer le fibroïde, il y a l'examen ultrason et encore le IRM. De cette façon, on peut localiser le fibroïde. Yes, please.
It is important before planning for the surgery, we see that fibroid is where inside the uterus. Some fibroid are inside the wall. They are the intramural. Some goes outside. They are the subserosal. Some goes inside the cavity. They are submucosal. And based on their location, we plan our surgical treatment.
Il est important de localiser ou bien d'identifier le type de fibroïde que nous avons. Il y a ces fibroïdes que l'on appelle intramural et il y a des subsérosales, il y a des submucosales et il y a encore le quatrième qui est bien listé là. Et il est important de le distinguer, de le lister de cette manière-là pour savoir de quel type de chirurgie avant d'entamer la chirurgie. Yes, please.
Any fibroid can cause problem, but if the fibroid grow inside, they can burst, they can cause pain, or they can cause heavy period.
Tout fibroïde peut poser des potentielles complications. Une fois qu'il n'est pas soigné, les fibroïdes sont susceptibles d'accroître, de grandir, de causer un peu d'avoir des effets secondaires non plaisants, donc un peu difficile à gérer. Yes, please.
Important thing to understand, if we want to treat the large fibroid, if the fibroid growing inside, it requires more expert surgeon, new technology, and good team.
La chose la plus importante à savoir, c'est que nous attaquons beaucoup plus le fibroïde qui est large et encore plus ce dernier qui s'éclater à l'intérieur de la cavité et causer des douleurs extrêmes. Yes, please.
Yeah. Treatment depends on size, location, number of fibroid, number of age, and the patient if they want to go for the baby or not.
Le traitement de fibroïdes dépend de la taille, de la localisation, du nombre de symptômes de l'âge et encore plus du statut de fertilité.
If we
Yes, go
want
ahead.
to treat the fibroid with the medicine, generally we can do this treatment for the small fibroid. If the fibroid gives the pain, we can give the painkiller. We can give the hormone treatment. And sometimes in the small fibroid, we can go for embolization. Yeah. I think you can carry on. Hello.
Jonathan, please translate if you're on call.
Oh, sorry. I was off. My microphone was off. I didn't know. Pour le traitement médical des fibromes, prenons en compte ces aspects. Il y a les douleurs. Pour pouvoir gérer ces douleurs-là, nous donnons des antidouleurs. Pour ce qui est de la reproduction, nous donnons aussi de pilules pour le contrôle de, de la naissance. Et nous donnons aussi des traitements hormonaux et utilisant l'ultrason des lasers. Yes, please.
Right. In the embolization, we put some jelly-like material here, which goes in the artery, which supply the uterus and block the artery, so that fibroid will die with time and they will not grow. Yeah. You can translate.
Pour ce qui est de l'embolisation fibrone, il y a une machine que nous utilisons pour pouvoir traquer la maladie et essayer un peu de voir comment le traiter. Comme vous le voyez sur le slide, ce n'est pas requis pour les femmes qui ont besoin de donner naissance plus tard.
We have these facilities available in our hospital, but any woman who is having large fibroid or the woman who wants pregnancy later on, this treatment should not be advised for them.
Comme on le disait tantôt, il y a une machine qui traite les fibromes en question. Mais pour ceux-là, les deux catégories qu'on va citer, ceux-là qui ont développé ces fibromes, qui deviennent un peu plus larges, et ceux qui souhaiteraient avoir des enfants futurs, ce n'est pas une bonne option pour eux, ce n'est pas recommandé.
If women want future pregnancy, we go for myomectomy, means removal of fibroid. Removal of fibroid is called myomectomy. I think you can proceed first.
Ok, si la femme a besoin de pouvoir mettre au monde plus tard, nous procédons avec une méthode appelée la myomectomie. C'est cette procédure-là qui va devoir aider cette dernière.
We can do this removal of fibroid or removal of myoma, either different routes like the hysteroscopy, laparoscopy. Now we are doing with the robotic, and open route also can be used sometime.
Ok. Nous procédons par cette méthode qui est la myomectomie, c'est-à-dire l'ablation du fibrome plutôt, qui consiste à la myomectomie stéroscopique. Il y a la myomectomie laparoscopique et la myomectomie robotique et encore celle qui est assistée.
Yeah.
Yes, please.
If we go for the hysteroscopy, means we see the uterus from inside, and a small fibroid which is inside the cavity, we can take out through the uterus without giving any cut. Means for the small fibroid, we can just take out from inside through the vaginal route. We don't give any cut.
Ce qui est de la myomectomie stéroscopique, nous procédons de la manière suivante, c'est la procédure de la garderie. C'est fait pour petit myome intracavitaire. Si la myome est à plus de 50% dans la cavité, nous procédons par cette méthode-là et vous n'avez pas
And
Yes, please.
it is daycare, means the patient will be admitted in the morning and patient can go home in the evening. No blood loss is there.
C'est beaucoup plus rapide, c'est-à-dire que le patient peut recevoir ce traitement le matin et s'en aller le soir. Il n'y a pas de perte de sang, il n'y a pas vraiment de complications. Yes, please.
Laparoscopy or robotic myomectomy. Once the women want to have the another baby, we go for removal of fibroid with the minimal invasive treatment. We make a small hole and take out the fibroid, either laparoscopy or robotic.
Pour la myomectomie, laparoscopique ou la myomectomie assistée par la robotique, c'est un traitement mini-invasif pour les patients souffrant de fibromes, notamment ceux qui souhaitent maintenir leur fertilité. Les patients peuvent s'attendre à une diminution de l'adhérence et à un retour rapide d'une activité normale. Okay.
In this technique, there's minimal blood loss, less pain, and quick recovery.
Dans cette technique, il y a perte de sang minime et moins de douleur post-opératoire.
But this technique requires intensive training and surgical skill for the surgeon.
Mais cette technique requiert une formation intense. Cette chirurgie nécessite une formation intensive aux compétences chirurgicales, telles que la suture intracorporelle, l'extraction d'échantillons.
This is picture of Max Hospital where I'm working.
Et la photo de l'hôpital Max où ces chirurgies sont faites.
And here we greet every patient like in Indian Namaste.
Et ici, vous voyez, c'est nous souhaitons la bienvenue, nous saluons tous les patients de la manière de l'Inde.
This is my team where in the OT with the anesthetist, with the surgeon, with junior staff and technician.
Ceci est mon équipe, cette photo. Je suis là avec mon équipe. Il y a tous les membres du personnel, des techniciens, de tout ce qui vont avec.
This we have the robot, which is the hind robot, the best robot in the world. It is Da Vinci robot, which has the artificial intelligence technique.
Donc, voici le robot le meilleur d'ailleurs dans le monde que nous avons ici, du nom de Da Vinci, avec l'intelligence artificielle.
And this is console where I'm working, doing the laparoscopic, doing the robotic myomectomy is going here. And I'm sitting here and doing the surgery with my 2 hands using the joysticks here.
Voici comment on procède avec la myomectomie robotique. Nous voilà dans la photo à prendre les procédés avec cette machine-là que vous voyez.
We have operated for few patients and they are very happy with the surgery. We did laparoscopy also. We did robotic myomectomy also. And therefore, if you want to send any patient, you can contact the Jivo, who is very good renowned company for the medical tourism and for the person who seek the really medical advice, and they contact them there and they really try to talk to the doctor here They make the arrangement so that the patient can talk to the doctor, patient can understand what are the disease and what is the treatment modality. The patient will sick here. And once the patient comes in our country, they take total care from in and out. If you have any such patient and you want to send to our country for laparoscopy or robotic, you can contact with the Jivo and your patient will be taken care. If you have any query, any confusion about the treatment plan, you can contact with them and we can talk one by one on the WhatsApp video call or the Zoom video call. Thank you.
Voici un peu ce que nous faisons. Et voilà une des technologies les plus avancées en main que nous avons avec l'intelligence artificielle, que nous disposons ici à Max. Et la photo d'avant, vous avez vu quelques patients que nous avions pu traiter le sourire aux lèvres pour la chirurgie réussie. Une fois que vous avez des patients qui ont besoin de cette chirurgie-là, et entrer à la suivante, et pouvoir nous les récupérer à travers la plateforme Jivo. Et d'ailleurs, cette plateforme qualifiée pour aider vos patients à recevoir les traitements et bénéficier des infrastructures médicales que nous avons ici. Vous pouvez les référer et ils viendront. Je pense que vous avez des questions, vous pouvez poser.
If any questions, we can take the questions. Any query?
Vous avez des questions, vous allez les poser. Nous allons procéder aux questions.
Whoever wants to ask a question, please either raise your hand or unmute yourself. I have some questions on Google form as well, which you guys filled. So I think this is the right time if someone is on call and if they want to ask the question themselves with the doctor or discuss any case which you are currently facing. So Dr. Ebenzer, you have mentioned a question. Please unmute yourself and ask.
Docteur francophone, si vous avez des questions, il est temps de pouvoir les poser directement. Il y a d'autres questions qui sont déjà notées. On va devoir transférer au docteur après les questions en direct. Mais en tout cas, sentez-vous à l'aise.
Dr. Ni Abdul Saki.
Yeah.
Okay. So Dr. Justin Bruno, if you want to ask a question on call, that would be great. Else I'll read it on your behalf. All right. So let me read the question, ma'am, for Dr. Ebenzer Neil Adush. She has asked in the chats. Please, can you talk about the link between folic acid intake and uterine fibroids?
Generally, we say that any content, any diet which is rich in folic acid, that will give the nutritional support to the uterus and they can reduce the fibroid. These are the epidemiological studies, but we can't say if the person is having fibroid, we give the folic acid and fibroid will go away. I think someone wants to translate. No? Then
I think the question
acid,
is asking.
okay. Folic acid is not the treatment, but yes, you can give as a preventive measures in the high-risk cases.
Got it. Then I have some more questions in chat and form. Let me ask if no one is asking. So I have this question from Dr. Kayan Bono and Deborah. He has asked, what are some of the symptoms of a high-risk pregnancy if it can be detected early?
With the fibroid, generally the high-risk pregnancy with the fibroid, patient is saying the pelvic pain, which is more than the pregnancy. We think that there's a fibroid, which is causing problem. If the woman is pregnant, they are having more urine problem. It may be the fibroid is the anterior part of the uterus and pressing over the bladder. Sometimes female have more rectal pain, pelvic pain, pressure. Then we think that the fibroid is in the posterior part giving pain. Sometimes there is a irrespective. Once we touch the uterus, the patient have pain. It means there's a degeneration in the fibroid, which is giving pain. So they are the early sign where we understand the woman is having fibroid. We go for the ultrasound, understand, okay, fibroid is causing problem for the woman or not.
Yes, I can see some more questions. Doctors, if you want to ask yourself, like Dr. Justine Bruno or Dr. Darren, Dr. Isaiah, no, I can see all of you posting questions. It would be great if you can ask it yourself.
Okay, thank you very much. Am I audible enough?
Yes, ma'am, you are audible.
Okay, thank you so much for the presentation. Mine is to understand how exactly does the fibroids cause the throbbing and burning pain during urination. How does it come? Does it predispose these people to UTIs readily? How does it come in?
I couldn't understand the questions. Can someone be more clear about it? Hello?
Hello, probably I can repeat again.
Yes,
In the presentation, the way these people present, one of them was frequent urination and that burning or stingy pain.
Right.
So how do fibroids
Yeah.
predispose these people to that
Right.
stinging pain?
Yeah. Because the fibroid, if they are on the anterior of the uterus, because we know that the bladder is anterior, then there is a uterus, then there is a rectum. If the fibroid is on the anterior surface of uterus as a growth, then it will separate the bladder from the uterus. And then once the woman will go for the washroom, and this fibroid will impinge there in the urethral region, or they will impinge on the neck of the urethra, they can cause the difficulty in passing urine, and this causes the pain sensation.
does it answer your question, ma'am, or do you have any follow-up questions?
Yes, please. It's been answered. Thank you.
All right. So we have more questions if someone wants to unmute themselves and ask. I can see more questions from Dr. Izzuddin, Dr. Elisa. All right. So let me ask questions on their behalf. I will start with Dr. Justin Bruno. He's thanking you for the informative session. His question is, can Trentix acid used in treatment like reducing the size of myoma?
What the question is?
The question is, can Tentremix acid used in
Tranexamic
treatment?
acid. Okay.
Yeah, sorry for
Okay.
the
I
pronunciation.
can see
Yeah.
in the chat box, and I can take one by one.
Sure, ma'am.
Tranexamic acid doesn't reduce the size of myoma. Tranexamic acid makes the clot formation. Any woman who is having heavy bleeding because of the fibroid, we give the tranexamic acid and vessels will be having clot and bleeding will be reduced. But size will not reduce with the tranexamic acid. One more question I can see. How so far can progesterone hormone reduce the size of fibroid? Yes, we give the progesterone sometime in the fibroid, but it reduced the size by only 20%. So therefore, we give the progesterone for the women where we wait for the surgery or where we can't do the surgery and patient is having heavy bleeding, but progesterone is not advisable in the patient who is not having any problem and having fibroid. We can give only in the heavy bleeding, and surgery is the better answer than the progesterone.
And then we have another question by Dr. Elisa. She wanted to understand management of fibroids using medication without surgery and what are the possibilities.
Yes. If a girl or woman who is coming with the heavy bleeding and fibroid is not inside the cavity, then yes, we can give the medical management. There we give the painkiller, we give the oral contraceptive pills, we can give the GnRH injections. GnRH injections reduce the size of fibroid, but once we stop the GnRH injection, after 6 months to 1 year, fibroid size will increase. Therefore, medical management of fibroid is advised maybe for 1 year or 2 years to overcome these symptoms. In the long run, medication is not very much advised for the fibroid. But again, a woman who is around 50 years coming with the heavy bleeding, she is having fibroid. We know that maybe after 1 or 2 years, she will go for the menopause. We can try with the medicine and stop the bleeding because after menopause, fibroid usually shrinks. Third, patients who is having fibroid, having bleeding, and she is having marriage after 2 months. We don't want to do the surgery for them. We give the medicine, shrink the size of fibroid. We say that go for pregnancy with a reduced size. If they don't have pregnancy, we operate. Yes, medicine can be tried in the pre-op patients where we can't do the surgery or the fibroid were very small. Fibroid is causing heavy bleeding. There the medicine has strong role. The one questions, Dr. Isaiah, what is the role of gonadotropin, agonist used in India, Luproid and Goserelin? Yes, we can do anyone, and both are really helping to reduce the fibroid, and different setup are using the different one. But you can use anyone to reduce the size of fibroid. Do you suggest that a scan, Jen is asking, do you suggest that a scan measures of 5 centimeter fibroid should be surgically removed? Very interesting question. If a woman who is having 5 centimeter fibroid, but if it is coming inside the uterus, causing heavy bleeding, obstructing, then yes, it is needed. If a girl who is having fibroid, which is outside the uterus, not causing any problem, there is no need to operate. If a girl who is having fibroid inside the uterus, means in the muscle layer of the uterus, and it is causing problems, she has to go for the baby, she has to go for the IVF. So many times we have to remove the fibroid. Therefore, it is important to understand what are the symptoms, what is the need, and where is the fibroid, what are the size. Each and everything we should count collectively before the releasing, planning for the treatment. The one, Mr. Jen Debaha, he is asking, what are the relations between the fibroid and menstrual pain? If the fibroid is in the cavity, it is like the foreign body in the cavity. So once the menstrual pain start, contractions of the muscle occur in the uterus, and then person can have the pain because every contractions uterus try to take out the fibroid. Therefore, they have the menstrual cramp. It is just like in the labor, the uterus wants to take out the baby. If the fibroid is inside the muscle of the uterus, then what happens? The size of uterus will be increased, surface area of the uterus will increase. That can cause much more pain and bleeding both. So that is also the pain and bleeding is associated with menstrual cramp. The one question in French, I think, is for the embolization. Other I can't read. But for the embolizations, embolization is a very good technique without any surgery, without any medicine. But yes, it can't be done for the fibroid, which is calcified, means there is no blood vessels going inside the uterus. In the fibroid. The second, it can't be done for the woman who is seeking the pregnancy, because if we embolize the uterus and fibroid, then blood flow to the uterus will be decreased. Once the blood flow to the uterus will decrease and she will go for the pregnancy, then what happened? Baby will not get the nutrition, no blood supply, and baby growth will be hampered. Therefore, we can't do the embolization for the person who wants the pregnancy. So for the small fibroid, the fibroid number is less, we can go for the embolization. Fibroid which is not calcified, we can go for embolization. And for the female who completed her family, doesn't want another baby, we can go for embolization. Another questions, I would like to have an idea about the fate of myoma nuclei after embolization and the region justifies contraindication in women wishing to conceive in the future. No. In fact, what we have discussed, why is the contraindications? Because blood flow to the uterus will decrease if we are embolizing the uterus with the myoma. Because there was a blood, what we do in embolization, we put the things which will block the artery. Once artery will be blocked, no blood will go. Once the blood will not go in the uterus, this blood flow to the uterus will be decreased. Therefore, we should not go for the woman who is conceiving after the procedure. We should not go for the embolization. Rather, we should go for removal of uterus. Here in Tanzania, there are several cases on infertility issue. Is there any actual management of this in terms of medication? In infertility, there are several causes of infertility. First, we have to decide what is the cause. Most common cause is either tubes are blocked or the woman is having eggs are not adequate or they are less. Third thing is that they are having some problem, like they are having fibroid, they are having adenomyosis, they may have some endometriosis. The different treatment is for them, different medications and different treatment. If the women who are having fibroid and we don't want to go for the surgery and they want to go for pregnancy, in that cases, we can give them GnRH, shrink their fibroid, because shrinking effect will be for 6 months to 9 months. In between, we can give, once the fibroid will be shrink, we can give them medicine and they can have the pregnancy. And the symptoms of the high-risk pregnancy, early detection, I think we discussed. And how can endometriosis be cured completely? And how can someone with endometriosis get pregnant easily? Early detection of myoma in pregnancy we discussed. And endometriosis, complete cure of endometriosis is mostly not possible. But yes, early detection and timely treatment, adequate treatment of the endometriosis, the pre-treatment of the endometriosis. If you detect there is a endometrioma, better to do the cystectomy, take out all the endometriotic tissues there, make the woman to become pregnant, and so that if the recurrence will occur, then pregnancy will not have any issue. We can give lots of medication. So therefore, early detection of endometriosis and adequate treatment. First surgery is the most important for endometriosis. If we don't do the first surgery properly, then recurrence will be more and more. What are the best way to treat PCOS? PCOS, we all understand that it is the lifestyle disease. The most important treatment is the lifestyle changes. Decrease stress, dietary habits to be improved, good exercise, and meditation. If the woman is really having problem, we should treat the symptoms. Like if they are having delayed period, we have to give the medication, OC pills. If they are having lots of acne and hair fall, we can give the medication accordingly. But important thing is that sometimes woman doesn't conceive with the PCOS. Then we have to start the ovulation induction. We have to take care of the egg releasing part, and then we can take help from the expert. Conservative management of the symptomatic uterine fibroid. Symptomatic fibroid means the most of the time the fibroid can give heavy bleeding. We can give the tranexamic acid. We can go for the Mirena insertion if the cavity is normal. We can give the hormones. But if the woman doesn't respond to that, we have to go for surgical treatment. Sometimes the woman who is having more symptoms because the pain, because the pressure, then we can give the GnRS because GnRS reduce the fibroid by 40 to 50%. And then pressure symptoms will be relieved. I would love to know if the presence of 1 wart over the vulva can be significant. Generally, the vulval wart are the low-risk human papilloma virus. If the girl or woman is having 1 wart, which is at the vulva, they may be having more wart in the future. Therefore, we have to see that if the more wart are there, we have to treat them. We have to see their partner. If they are having wart, we have to send them for the treatment. But we should counsel the woman that it is the low-risk virus. We have to see for the high-risk human papilloma virus because they are the high-risk virus can cause the cervical cancer. We have to go for HPV DNA testing for that female, and what we can take it out and send for the biopsy to understand it is only what, nothing else. What exactly the implication of dietetical factors in the genesis of benign growth in the uterus? Usually, these growth, fibroid, endometriosis, adenomyosis, they all are the immune system and stress-related disease where the hormones is increasing in our body. Therefore, most important thing is the decreased stress. Stress radical oxygen should also be decreased. Therefore, if the woman can leave the smoking and excessive alcohol, if they are taking more folic acid, they are taking more vitamins, and especially vitamin A and C, which repair the cells, they are having less hormone producing problem like the adenomyoma, like the fibroid. Yes, dietary role are there, but genetic is also very important. Therefore, we have to explain the woman if yes, they have to go for the diet modification, but if they are having high risk for developing these fibroid, they should go for their checkup with the ultrasound, or if they have any symptoms, they should go to their doctors. What is the real cause of uterine fibroid? So many years, fibroid is coming as the most common cause But till now, we don't know why the fibroid grow. Our olden gynae book says that once the woman can't produce the baby, they produce fibroid. It means if the uterus is having more unopposed estrogen, more fibroid is formed. Anytime if more estrogen in their body, they can have the fibroid. After myomectomy, there is some adherence like cicatrization trouble. Do you think that physical therapy is the only one helpful therapy is for dropping those adhesions? Okay. Yes, for any surgery, we are doing any of the surgery, adhesion formation is the rule. Some women have less surgery, less adhesion formation. Some are having more adhesion formation. Lots of anti-adhesive materials are there in the market, but important thing is that if you are doing surgery and if you are opposing the tissue more accurately, not leaving much bleed inside, clean the tissues around it, less adhesion formation occur. If there is more blood, you can put the drain for this sometimes so that all blood will be coming out of the drain. And once we operate such patient and they come for the pregnancy and we do the cesarean, we find out there is no much adhesion in these women. Sometimes we can put the momentum over the repair area or the fibroid so that bowel will not go and adheres in this area. Otherwise, you can use the all anti-adhesive treatment. Regarding the physical therapy, no drugs or no medicine or no dietary advice can really reduce the adhesion. Yes, sterilization of instrument is very important. If a woman who develop the infection after the surgery, they can have more adhesion formation. I think I finished all of them or anything.
Yes, ma'am. All these questions are till now, and I would like to thank you for your time, and I would like to thank everyone for their time. So see everyone next weekend with a different doctor and a different seminar. And thank you very much, ma'am, for taking out your time on a Sunday evening.
Thank you. Namaste. We always greet by namaste in India. Therefore, I will do the namaste again.
All right. Thank you, everyone.